This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. The Virginia Chamber of Commerce, the voice of the Virginia business community, working in legislative, regulatory, and political arenas to promote the free enterprise system. Information at vachamber.com. Virginia hospitals and health systems provide jobs. They support our economy and promote public health. Local hospitals are always open to help people with unexpected health needs. Having a stable healthcare network is vital. Virginia hospitals are our lifeline.
I just received a letter from a student who thanked me for instilling the love of math in him. That's why I teach.
Brought to you by the Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.
Welcome to This Week in Richmond, and a welcome back to one of our guests, and then a welcome to a new guest, Mary Mannix from Augusta Health, and Sean Connaughton from the Virginia Association of Hospital and Healthcare Association. Got the name there. And you're also chair of the board, so you both have that connection. In preparing for the conversation with you today, I was looking up some information, and I went on Christopher Newport's site where they have the Judy Wasson Center, and saw that last fall, and their survey of likely voters in the fall about what were the hot issues, healthcare, as you know, and our viewers should know, was right there among the top issues that people were concerned about. You know, the economy and jobs and education, but healthcare was right there. So I'm glad we can have this conversation on healthcare and on the involvement of your members and the hospitals around the Commonwealth, because this is a big week coming up.
Yes.
That former Senator John Watkins got a resolution passed and unanimously in the 2015 session designating this week coming up, the second week in May,
Yes.
as a very special week.
So happy Virginia Hospital Week.
Yes, yes. And it was about time. We have weeks for almost everything else. I mean, something's being celebrated in the week, and so, I read that resolution, and I'll let you all talk in just a minute. But I read that resolution, and he really started with something that's obvious, and yet we don't often think about: 24/7, 365.
Yes.
And in this year, I guess, 366 days. That other than public safety, I was trying to think, what else is 24/7, 365? And you are there along with public safety.
Yes.
So talk to our viewers then some about what's this week going to be like, and what's happening in the Commonwealth.
Sure.
Well, Hospital Week is just a wonderful time to pause and reflect and to be grateful for all of the people that work in hospital and healthcare settings. As you mentioned, it's a 24/7, 365-day-a-year job, and we have to be open to our communities and accessible and available. And the theme for Hospital Week, Hospital and Healthcare System Week, is patients come first, as they always do. Our community and our patients always come first. But it's a wonderful time to celebrate what we do. We are passionate about caring for our communities. It's the most important thing to us. And there are so many people that are involved in the teamwork that's required to pull that off. And so Hospital Week represents a great time to celebrate that and to thank that team. And that team goes all the way, from frontline folks, caregivers, people that are behind the scenes that patients and families never see, boards of directors, volunteers. It's just a wonderful week to celebrate all of those individuals that are so committed to caring for the community.
And all the time available. All the time available.
Yes.
24/7.
Yes.
And it's interesting, in many ways when you look at what hospitals and the healthcare system provides, many people don't realize or think about it until they really need it, until a family member needs it, until an employee or a coworker. And I mean, this is a sector of the economy. This is that is across the entire Commonwealth. There's 107 hospitals in the state. It's covers pretty much, there's a health presence in practically every community. You look at the fact that there are 120,000 people directly working in the hospitals, another 300 or so thousand in all the ancillary services and other types of healthcare services that are being provided. Pretty much 1 out of every 9 jobs in the state, in the Commonwealth of Virginia, are actually tied to healthcare. So it's about being there for the communities, it's about being there for people, it's about being there for their patients, but also incredible economic driver. It's something that really we should celebrate everything that is happening in all the hospitals and all the great things that they do in their communities.
Living here in the Richmond area, and in the last year having the occasion to go with a family member to a hospital, it was really the question, okay, which hospital do we go to in the middle of the night?
Right.
In some parts of the Commonwealth, that's not so much the case. And it may be close in the community, or it could be some miles away. Augusta Health, in an area that's not extremely rural, but yet more rural than this. What's it like both in your area and in areas that are rural Virginia?
We serve an area that covers a population base of about 200,000 people. And they come from Augusta County, of course, but also from the southern side of Rockingham, Bath, Highland, Rockbridge, northern side of Nelson, the far western side of Albemarle. So that's a very large area. In fact, Augusta County is the second largest landmass-wise county in the state of Virginia, the Commonwealth. And so that's a large community to care for and to be accessible for. And as Sean had mentioned, not only are we there to be accessible and available for our communities, but most often we are the largest employer in the region, and that's also the case with Augusta Health. We're the largest private employer in the region. So we have 2,400 people that work with us on a full-time and a part-time basis, and also depend on Augusta Health to be strong, not only for the community, but also as an employer as well.
So those numbers that you used, and also the ones you used, Sean, are basic employees. It doesn't include the doctors who come and see patients there. It's really the hospital employees.
Yes, and although there's many changes that are happening in the healthcare sector today, and Mary can really give you much better information about that. But there is a transformation happening, not just simply in we look at the politics and the policy, and most people, when they deal with healthcare, they're thinking about insurance. They're not realizing that actually over the last 5 to 10 years, there's been dramatic changes in how healthcare is actually delivered to people. Hospitals used to be, I'm going to say, there for acute care, essentially when you needed somebody in the middle of the night, like you mentioned, or there for operations, whichever. But now the hospitals have become the center for providing health services for an entire community instead of the place that people went to sort of at the last resort type of thing. And Mary can maybe talk to you a little bit about that.
Yes.
So at Augusta Health, for example, 65% of what we do is actually outpatient work, and 35% is inpatient work. And that outpatient work takes many forms, over 500,000 encounters a year for Augusta Health. It could be access to physicians in outpatient settings. It could be access to urgent care. It could be a meeting with a clinical dietitian or a case manager. It could be coming to a medical home clinic. Our emergency room, 60,000 encounters a year, could be coming to the emergency room. Many different settings. We have a fitness center. It could be coming to the fitness center as well. And what's happened is this transformation is all about, quite frankly, keeping people out of the hospital, keeping people healthy, And if for those who have chronic diseases, successfully helping them with their lifestyle and with their chronic disease management so that they stay outside the four walls of the hospital.
Is telemedicine coming more and being involved with hospitals? I'm aware somewhat about that in the veterans services where they're providing some telemedicine. Is that somehow interfacing with hospitals at all?
Most definitely, especially those hospitals that are located in rural areas, and to have the ability to be able to connect with another medical center, for example, that might have tertiary capabilities, that can really be a very effective way for rapid diagnosis and treatment of patients, absolutely.
And it's interesting, people don't realize that Virginia is actually one of the leaders when you look at a statutory and regulatory framework to allow telemedicine to occur.
Oh, excellent.
And so it is, now it's trying to figure out really how you use those services to actually deliver medical services throughout the entire Commonwealth. And in many ways, where you need telemedicine, many rural areas, it is about also providing access to those people to get to and use the internet and things like that. So it's a big transformational item that's happening right now. And I think in many ways, the hospitals and health systems are still trying to figure out how to integrate it. But Virginia's been a leader in actually providing that framework to allow the healthcare providers to try to utilize telemedicine.
So we're in the midst of the week now, not while we're having this conversation, but as our viewers are seeing the program, we're in the midst of this week. So what's happening to celebrate?
Well, at Augusta Health, we like to have kind of a whole series, and each day represents a different opportunity to recognize a different group. We're very focused on what we call our value celebrations, and these are the great things that we're able to accomplish through our value of teamwork and putting the patient at the center of everything that we do, where we come together and recognize just the wonderful accomplishments that we can achieve for our community, caring for patients and their families by practicing that value of teamwork and keeping the patient at the center of everything that we do. And so each day there's typically a different activity, something fun, something that makes everybody feel special and recognized for the job that they do. And it's actually a great week. It also is in close proximity, timing-wise, to Nurses Day as well. And you know, a lot of times when people come into the hospital, it's not only because they have to have a procedure, but they need care. And if you're an inpatient, it's typically you're an inpatient because you need nursing care. So it's great to recognize this large group of professional healthcare providers as well. As everybody in the hospital. Everybody has an important job, and as I mentioned earlier, they're all part of the team that help us to care for our community.
And it's interesting from a statewide perspective, one of the things we're trying to do is highlight some of the really interesting stories that are happening at our individual hospitals. As Mary indicated, we're encouraging each individual hospital to do things each different day and invite the public in, to get people aware of what's happening in their hospitals and to show their involvement in their respective communities. Part of the things we're doing at the association is obviously a lot of social media, some print advertisement and radio advertisement, to go out there and essentially highlight some of these individual stories. I mean, it's fascinating what people do at their hospitals. This helps support patients in their times of need. I mean, one story there was a story of a mother, who was undergoing treatment in one of the Centera hospitals. She couldn't leave the hospital because of the treatment she was getting. She wanted to see her son's Little League baseball games. The actual hospital actually built and essentially modified the field outside of the hospital so that she could actually see their Little League team came and played there, so that they could actually see, she could see her son play baseball. We have one of our members of the Children's Hospital at King's Daughters, where they recently had all the window washers and others wearing Superman and superhero outfits just to cheer the kids up. I
Yeah.
mean, these are things
Yes.
that you don't hear about, and they don't necessarily see in the paper, but these are things that are actually happening each and every day. And Mary is very much aware of that at her hospital. It is realizing that the hospital and the patients that are there, they do come first, and it is about making sure that though when they're there in their times of need, that also trying to remember that they're people too.
People come to hospitals typically in a time of need, and sometimes at their most vulnerable time in their
Right.
life. And so we have the privilege of caring for them and being with them during those moments. Sometimes you come to the hospital for a good thing. It might be to have a baby, and that's always a very positive event in someone's life. But, you know, twice in the past year, there have been 2 bus accidents, fairly significant bus accidents in our county. And as a working mom, I can certainly appreciate the terror of getting a phone call like that and knowing or not knowing, you know, what the disposition is of your child, of your loved one. And I think about those 2 episodes because one of those weeks I happened to be the administrator on call, and so when we opened up our incident command, I was the administrator and was able to partake in all of that and see our team come together. We greeted those parents, we greeted those children, we took care of those children, set up lines of communication so that everybody knew what was going on with their loved one at any particular point in time. Highly unusual that 2 of these events would occur in 1 year, but I think about what if Augusta Health wasn't there? What the mayhem that would have ensued when something, you know, as catastrophic like that occurs.
And that's the interesting thing about what hospitals have to be prepared for, is that everything from, I hate to say it, the day in, day out car accident or home accident to these types of catastrophes. I mean, we've seen it, everything from in Virginia, 9/11 and what happened at the Pentagon, to major bus accidents and hurricanes and tornadoes, and the hospitals are always there prepared to provide services to people in need.
That's why in my mind I somehow connect you and let 24/7, 365 with fire, EMS, and police, that they have to be staffed up at a certain level for their routine, but then they never know when there's going to be some major emergency
right.
that affects them, and any number of those emergencies affect them end up affecting healthcare hospitals as well.
That means your resources always have to be organized and ready and on standby because you never know when they'll have to be mobilized for an event like that.
And one of the things that we have at the association, we actually are essentially the executive arm or executive agents for the hospital preparedness network. And essentially we provide money and to help train up and prepare hospitals in case there is any sort of major incident. And we have councils throughout each region that meet regularly, and actually they go through, have everything from emergency equipment that can be provided to the hospital, to helping the hospitals have everything from emergency generators to wells in case electricity goes down and they need to have potable water. And these are some of the things, again, people don't see is happening out there, but it's something that making sure that if something really bad happens, the hospitals can end up providing those types of services.
And is it part of that setup where hospitals in that larger region would help one that had the greatest impact? I know we always hear that certain numbers of patients go to another hospital if it's overloaded, but I could see where there would be it would be different ownerships of different
Sure.
hospitals, but all pooling together when there's an emergency.
We do. We form a network and we anticipate the roles of different organizations. A perfect example would be with Ebola preparedness.
Yes.
We identified those hospitals that were going to be prepared to receive, assess, and diagnose. We identified those who would be treating, and we identified those who at the point a patient presented to the emergency room would immediately transfer the patient. And so, you know, that network had to be established. We had to have tabletop exercises to simulate how that would work and make sure that we had adequate access, all, you know, in the event that something were to happen. So that preparedness, that anticipatory process takes a fair amount of time and resources as well.
That's got to be one of your big challenges, but what are some of the other challenges that are facing healthcare, particularly in hospitals?
Well, I think that reimbursement is clearly an area with the Affordable Care Act. I think the Affordable Care Act did some really good things in terms of creating a greater sensitivity to those who need access to health care that may not have access to health care, but at the same time, our reimbursements have been significantly reduced with the Affordable Care Act. And so learning how to provide and fulfill our mission in different ways at lower cost, and making sure that we provide the highest quality, therefore the greatest value to our community, and the best service. Those are all significant challenges right now. Recruitment is another challenge, and getting professionals, physicians, allied health professionals, et cetera. It's a challenging time right now in terms of healthcare in so many ways, but I really think that the transformation that we're in is a great challenge, but a great opportunity at the same time.
And you know, just a key on a word that Mary keeps on using, reimbursements. I mean, this is not, this is actually getting paid for services that the hospitals and healthcare providers have already provided. And so what we've seen happen, and now it's getting worse, one of the things that's happened in Washington is with the Affordable Care Act, they are reducing payments for how much they're reimbursed for Medicare patients, and that continues to go down. There was built into that law an expectation that there would be less indigent care, less people with no insurance. And so we're seeing many of these programs that are there to provide money for areas like a Richmond, downtown Richmond, where there is a lot more uninsured, what we call DSH payments, disproportionate share payments. That program is going down. And then, you know, we have in Virginia where the Medicaid program, which is a 50-50 cost split with the state and the federal government, those reimbursements are going down. At the same time, you're seeing the population get older, and you're seeing, in the average in hospitals now is about 60% of the patients are Medicaid and Medicare. And about another 5 to 7% are indigent and pay nothing. Even though in the general population, that's around 70% are actually commercially insured. So the people that are going to the hospitals and being provided care are obviously the people who are older and sicker. And so as we deal with some of these financial issues, you know, it's a challenge for all the health systems in the long term, because on one hand, they're being asked to provide, you know, new services, look at the greater population, get to patients and keep them well so they don't have to go to the hospital. But that costs money, and that takes a lot of effort and initiative to do so. At the same time, the money from the traditional programs are going down.
You know, I think we as Americans have had fascination with healthcare and with medical matters, and people are seeing this by way of television. And I was doing some checking. 1951, City Hospital was one of the first medical shows, and by my count, there's right at 100 different television shows that have been on hospitals. I mean, some of us grew up on MASH, others on ER or whatever the time was. But I think that people, that none of those really give the kind of picture of really what's happening inside probably the real hospital that's on a day-to-day, whether it's Augusta Health or whether it's any other hospital. But I think there's a fascination with healthcare that shows that that's one of the big issues that we're concerned about. Yes. And so we maybe need to have a show on Augusta Health or your unsung heroes and heroines story that would let people know what's really happening in healthcare.
And you know, for a community hospital, it's providing care through many different settings, but it's also about caring for your community in different ways. Every summer we have career camps for middle school, elementary school, and high school. We also collaborate with the high schools in our areas and do mentorship experiences for the high school students, or capstone projects for those kids that go to governor's school. We do health screenings, a lot of programs that are outside the direct healthcare mission of community hospitals. And you know, I think that that's really an important part of who we are and why we tend to be cornerstones of communities.
And,
That's a story that needs to be told, and we've told it as much as we can on this show, but we'll
Yes.
tell it again. But that's a story that needs to be told, that people would hear. So thank you both for being on this
Thank you
week.
for
Thank you,
having
Janet.
us. Thank you.
Patients come first. Happy Virginia Hospital Week.
Yes, yes.
This Week in Richmond is made possible in part by Dignity Memorial, caring for our communities with a network of funeral homes and cemeteries in Virginia and throughout North America. More information about Dignity Memorial's providers is online at dignitymemorial.com. The Virginia Chamber of Commerce, the voice of the Virginia business community. For jobs, the economy, and public health, Virginia Hospitals, our lifeline.
The Virginia Education Association, because a good education is good for everybody.
Additional support is provided by these sponsors. And by the members of Virginia's public television stations. Thank you.